Welcome to the tutorial about SureSmile aligner. I am Dr. Gertrud Fabel, and I'm going to speak on some fundamental aspects on SureSmile aligner therapy. Well, I'm going to share my slides with you, and I hope you can see everything correctly. And I thought about starting with the abstract, what we are going to speak today and what you are going to learn. Well, I'm going to speak about the reasons for aligner therapy in a GP practice. Approximately 60% of all adults have crowded teeth in one or both arches, which can cause not only aesthetic concerns, but also periodontal problems and difficulties in prosthetic planning. Aligner therapy has become increasingly popular thanks to its ability to treat not only easy to moderate cases, but also improve speech, chewing and swallowing, and potentially alleviate issues such as CMD or obstructive sleep apnea. Furthermore, aligners are often used before starting prosthetic or implant treating to achieve optimal results. For beginners in aligner therapy, a reliable product, smart treatment simulations, and a fast results with minimal refinements is crucial. That's where SureSmile comes in, as it offers all of these benefits and more. We want to also talk about the possibilities of aligner therapy. In implant cases, the opening or closing of gaps leads to reduce the number of implants, or in contrary, makes implantation possible. In these cases, the dentist can upload a CBCT to have a better diagnosis and get a better treatment plan. Using an intraoral scanner and great digital tools make aligner treatment comfortable. SureSmile offers a seamless workflow for all PrimeScan users, although the lab accepts STL data of different scanners as well. Everything starts with a scan, panoramic X-ray and photos, intra and extraorally. Cloud-based SureSmile treatment software completes the data, which allow us to make the right decision and recommendation for our patients. Criteria of cases which can be treated by general dentists might be up to 5 millimeters of crowding or spacing, midline deviation up to 3 millimeters, overbite and overjet up to 3 millimeters, open bite up to 1, let's say 2 millimeters. The upload of the required X-ray photos and intraoral scans is easy. Can be done, for example, by team members. Cloud access to DS-Core brings for all digital dentists the advantage that all uploaded files can go to the SureSmile page directly. Collecting data in DS Cloud out of DS equipment works automatically and reduces desk time. After a few days, the doctor gets the treatment proposal. The staging must be reviewed. Crowding in the lower front teeth often leads to severe wear, discoloration, or frequent loss of fillings in the upper incisors. Before considering veneers or crowns, aligning the lower incisors can help improve and preserve antagonistic tooth material, and in many cases, a minimally invasive or non-invasive treatment is sufficient. In implant cases, Opening or closing gaps can reduce the number of requested and required implants or make implantation possible. Dentists can upload an CBCT for a better diagnosis and treatment plan. The use of intraoral scanners and digital tools can make aligner treatment more comfortable. SureSmile offers a seamless workflow for all PrimeScan users, although the lab accepts also STL data from different scanners. The treatment process begins with a scan, panoramic X-ray, and intra and extraoral photos. The cloud-based SureSmile treatment software completes the data. Uploading required data such as X-rays is easy, and the cloud access to DS Core provides that the advantage that all uploaded files can go to the SureSmile page directly. Well, in the third part of my lecture, we talk about orthodontics in a GP practice. Basic orthodontics knowledge of occlusion is necessary to accept treatment proposals and involves using Andrew 6 keys to check angle class, tip, torque, rotation, spaces, and crowding, as well as the S-curve. Once the aligner is ordered, it takes about 2 weeks for delivery to the patient. The first appointment involves adjusting IPR and fixing the attachment using the attachment template. Patients should receive advice on the timing, use, and changing interval of the devices. Hygienist cleaning appointments are usually recommended every 8 aligners. After completing the aligner treatment, retaining the teeth is crucial. Whether patients receive fixed or loose retainers, they must be checked at a short intervals during the first 6 months. While biomimetic digital dentistry copies nature in the best way in prosthetics and restorative therapy, we use digital tools in orthodontics to improve nature. Aligner treatments often simplify steps or reduce therapies in all-over plans. Well, that's more or less all we have to look at in the next couple of minutes. And we start with the first point and speak about the reasons for aligner therapy, the patient's view, the dentist's view, and how SureSmile can support us. Well, the patient has different reasons why he or she comes into our practices. And when we have an overall look, why patients come worldwide into dentists' offices, it is, in addition to pain and discomfort, almost a quarter of them who want an aesthetic improvement in their appearance. In many cases, it is whiter teeth, but very often also a straight, flawless row of teeth. Well, mostly it might be a combination. Maybe one of the family members or a friend is already wearing aligners, so that the wish also to improve the smile becomes bigger and bigger until patients show up in our practices. What all patients perceive is, for example, crowding. According to a study from 2022 with over 630 cases, 46 of all the patients have crowding in the lower jaw, and 63% of children and teenagers do have that. Most predominant type here is mild to moderate cases. So more than 85% of crowded teeth in the lower jaw are mild and moderate. In practice, however, patients present themselves with other expressions. They associate a flawless smile with better social status at work and in society, with more self-confidence and self-awareness. They want a great profile pic in social media and dating apps. And what's more, aligner treatment has become kind of a status symbol, showing that you value your appearance. While the dentist has a closer look and a more differentiated view of his patient's dental health. I mean, I don't use always the microscope, but we look very close to the periodontal situation of our patients. Well, I just noticed I have the German word here. Okay, we control the TMJ and we treat CMD. We look after chewing and speaking skills. We strive for simplification in planning surgical, implant, and prosthetic cases. However, economic conditions and earning potential must also play a role in our businesses. Here, forecasts seem to predict growth. Here it is particularly important between all the online providers to highlight our medical aspect and our expertise. It also includes being able to deal with objections. May they come from patients or may they come from colleagues. What did you hear already? Aligners don't work. They work only for small cases. You can't move roots. You only move the crown. You don't need attachments. And patients won't wear them. Software does anything. Well, seeing studies, on the contrary, and research speaks a completely different language. The following studies can be cited as example. Clear aligners provide an aesthetic and comfortable option to conventional fixed mechanics. Obtaining periodontal health is easier in patients treated with clear aligners and less white spots lesions develop during the treatment. So teeth seem to be more healthy during an aligner treatment than they are during a treatment with fixed orthodontics. Clear aligners can be used in mild to moderate crowding cases. Yes, that's true, and caution must be exercised in complex cases. Well, we come back to that later on. Root resorption is still a risk associated with an orthodontic treatment in aligner therapy, such as fixed appliances. Well, and long-term stability studies have to be required in this field. And we have some results and some predictable results for treatment experience when using SureSmile aligners. No refinements were required on 3 of 4 SureSmile cases. Expert support every step of the way. SureSmile U is an online training resource to onboard you and your staff. The S Academy offers ongoing support through a library of educational resources and training events. Receive in-office support through our team of experts, field sales, clinical implementation specialists, and customer care associates. Well, we have SureSmile treatment aligner, we have SureSmile aligner treatment planning software, and it is integrated with virtually all Dentsply Sirona scanners, as well as other commonly used scanners. Now, as a part of clear aligner treatment, SureSmile V Pro is a high-frequency vibration device. Actually, I got it right today to have a look at it. And patients can use this at home to help aligners fit properly. SureSmile V Pro may reduce discomfort and may reduce treatment time when used 5 minutes a day with their aligners. Well, and SureSmile retainers are available for all our patients, designed to prevent teeth relapse and protect patients' investment in their smile. SureSmile aligner software user experience and intuitive interface helps to ensure greater efficiency through a streamlined and patient overview. And treatment planning tools that optimize workflow management. So those are all the advantages SureSmile offer. And coming back to research, you find some studies which explain the accuracy and reproducibility of the models. So this is, in my view, is very important. I mean, it's nice to have a perfect scanner, but it's a must-have to get perfect and exact models for the production of the aligners. We have a special algorithm in the SureSmile software, which I'm going to come back later on in that session. And I read an article about the effect of the margin design of the trim line on the aligner design, which is also very important. And I have a great example for different aligner trim lines to highlight what effect you can get by managing it. Well, so there is a lot of reasons to order SureSmile aligners, and there is a lot of reasons to also use the DS-Core Cloud. It is since a year, I think, a year or so, it is the one and only cloud solution for dentists, and it also is a comprehensive patient media library. It supports all digital workflows and is an unlimited and secured file sharing solution. So this is the description of the core. Well, and what do we get? We get seamless connectivity to all our Dentsply Sirona equipment and an automatic storage of our intraoral scans. And well, it's a tiny step towards a direction to be more sustainable in our practices, because local storage seems to be it seems to be less sustainable than storage in the cloud. Well, coming to a little bit closer the aligner treatment, we have a lot of indications, and we just want to have a closer look to those indications with cases I brought with me, and which I wanted to start just to see what is possible in aligner treatment in a general practitioner practice. So maybe let's start with Christian. It's not his case. This is Christian, and he is wearing a fixed retainer in the lower jaw. So he had an orthodontic treatment already as a teenager. Christian was one of the very first cases I treated with a SureSmile aligners almost 5 years ago from now on. And well, he made an appointment because, listen, doctor, he said, actually, I notice that this canine is moving towards the lip. And I notice also that my lower lip is like going underneath. And I don't like that feeling. Actually, I really want to have the tooth back in row. Well, this is the staging, and you can see kind of, well, torquing the tooth back seems to be pretty much everything we had to do. And it took us a number of 9 aligners. We had no IPR to do. We fixed 2 attachments. So Christian was one of the 23% of patients who come with very detailed wishes into our practice. This is the result, and you can clearly compare the planning and the result. I like it. Our next patient, she was very clear as well, Anna. She's about 60 years old, and very bothered about her gaps in the anterior region. One of the reasons for her unconventional tooth position is the strong tongue that habitually presses against the front teeth when she speaks. Well, at the first glance, I thought I could just torque all the front teeth back in row. But when we take a closer look, let me start the movie. We see it's not so much a torque movement, but it's more a rotation movement. You see that? Well, so it was in the staging a number of 10 aligners of the upper jaw, and the lower aligners was a number of 17, no IPR, of course, and 5 attachments. And before I ordered the aligners, I had a look at the movements, at the single movements in this treatment, and you can clearly see you have almost no torque, but you have lots of rotation. See? So in that case, I decided to choose the scalloped trim line and not the straight one, because there are studies which recommend scallop trim line in cases where you have to do a lot rotation. So maybe this was one of the reasons why we were really, really successful. The result is very nice. The patient is very happy. And you can also compare here the both pictures from the result and the staging model. Well, but what if when your practice has an surgical focus? Yeah, when your focus is implantology, the vast majority of implants are needed for single tooth gaps. Often we find one of the 2 following indications: the gap for the plant implant is still a little bit too large, and there is some crowding in the front at the same time. Or the gap for the plant implantation is too small, and you have gaps on different places in the row. Both of the cases are ideal for a pre-surgical, pre-implantologist aligner treatment. Well, this is Susan. Susan's case was very nice because the width of the gap which we would get after was calculated in advance. And in this case, I'm sorry, so in this case, after extraction of the upper left 5, we decided to eliminate the crowding, and the implant was placed on the very space we designed in advance, which means we started the implantation. The healing time would be the time where the patient was wearing the aligner, and after having finished the aligner treatment, we would set the attachment. So this is how it works. We start the records, have the data upload and setup and staging. In that case, we printed the final situation and used it for the implant guiding, implant placing, and healing time was the aligner time. So this is one of the advantages if you have more space. So this is the result. Happy patient, happy dentist, all fine. In Marina's case, it was the opposite. There was no space for an implant and gaps in the front between the lower right canines. So we decided to close the gaps in the front and use the space for the implantation. Well, the case is still going on, so I have no final pictures for you, but maybe if we meet each other in a couple of months, it will be done and ready. Yeah, and this is the treatment plan and the workflow in those cases. We start the records, upload the data, control everything, wear the aligners to open the gap for the implant placement. Then the implantation takes place, and after that, after a couple of months, it took us quite a while to open the gap. Yeah, I'm about to deliver the abutment in the next days. Going back to a more simple and aesthetic case, just wanted to show you a smaller case, and remember that most of aesthetic cases need aligners at the first step. They make things so much easier. And Stephen's treatment can be exemplary for simple tooth corrections. If tooth axis and position are corrected before replacing the crown in the anterior region, the subsequent prosthetic restoration is much easier to design. So in that case, we made the IPR only on the crown. So we made the crown about 1 millimeter more narrow. Then made some non-invasive composite fillings. Yes, I think this was the workflow. And in the end, we changed the crown. So now you have an almost perfect smile, and it was a comparable little effort in that case. Well, and my last case is Annika. Annika is one of my favorite cases, because imagine if you're 12 years old and your dentist has to tell you, well, Annika, you won't get laterals at all. And we have to close the gap by moving the canines toward the incisors. I only can imagine that she was not amused, and it was kind of a painful treatment. Well, not only that, she had a second treatment while in her 30s, and it was an aligner treatment of a different company. Jetzt muss ich kurz anstecken. Now I need some power. Okay, thanks. I'm sorry. Okay, so not only that, she had a second treatment in her 30s, and nevertheless, she wanted to have a third attempt. She wanted to make a third attempt and start again an aligner treatment in my practice with now very specific and detailed wishes for her treatment. Well, the canines should no longer dominate her smile. No tooth substance should be sacrificed by prosthetic measures. The treatment should take place within a manageable period of time. Well, and she rejected brackets. She didn't want the fixed orthodontics. Well, this is quite a task. And in her case, I decided to upload a CBCT, which I'm going to show you in quite a few slides. But in the end, well, it wasn't as complicated as I expected it would be. The only complication was that she went into holidays, and we redid the treatment quite after a few aligners, so we might kind of a refinement, which is possible whenever you find out, okay, your patient is not wearing the aligners quite well, or if anything happens, you can just stop the treatment and start all over and start a refinement again. And this is what we did. And it ended up to become a really, really nice result. Those are non-invasive fillings. And we also controlled the CBCT because we were really concerned about the tooth position. And I'm going to show you the final result. This is where we started, and this is where we ended. And well, I think it's hardly possible to get a better proof that you can move roots with aligners. So the result shows not only quite a nice smile, but also the disappearing of those buccal corridors. And I think also here, happy patient, happy dentist. Okay, so how to come into a perfect SureSmile workflow. This is the next few slides. I think maybe you are using intraoral scanners already, then you use it for documentation and demonstration already. You use it for analysis of contacts and movements. You are monitoring operations, and maybe you plan surgical guides and abutments. And of course, lots of my colleagues and also I myself, we do prosthetics chairside and lab side. Well, in case you are still making polyether impressions and getting plaster models, maybe you think about using an intraoral scanner, and then also use the possibility to start a liner treatment with that digital means. And well, speaking about digital presence and even more about digital future, the consequent question is, where will these data be stored in the future? Will it be a local storage or will it be a cloud storage? What would be more advantageous? Well, when you use digital X-ray units and scanners from Dentsply Sirona, the data collected here can be automatically uploaded in the cloud. Here you see my dental assistant and working on my patient. And she is already controlling the upload and actually also downloading the files for the orthodontic treatment. So there is a tiny small step towards sustainability, but maybe in quite a few weeks, in quite a few years, when everything is moving towards the cloud, it's not only a tiny step, maybe it's a big step. Well, in my view, local storage is going to an end. I'm very eager to work more in the cloud because I think this is offers a lot of advantages for me, and yes, also for my equipment. Maybe it's save some computers. Okay, but for evaluation of the orthodontic treatment, so coming back to that point, it is advantageous and necessary to refresh fundamental basic knowledge in orthodontic treatment. So let's start with the 6 keys of Andrews: the angle class, tip, torque, rotation, no crowding, no spaces, and a flat occlusion plane. What does it mean? Well, angle class 1 describes the normal bite, describes the neutral bite. The anterior cusp of the first large molar in the upper jaw meets exactly between the 2 cusps of the opposite first molar in the lower jaw, and the cusp of the canine meets between the canine and the first little molar in the lower jaw. Torque movement is a special type of tilting movement of the tooth root. So you move the root while the crown itself more or less remains at its original position. Tipping means you tilt the tooth while more or less the root stays on more or less the same position. So treatment example for tipping a tooth would be maybe the straightening of an open bite in anterior teeth. So rotations, gaps, and tightness is a lot easier to explain. You check that when you get your treatment simulation, your so-called staging. And the last view, the last look is at the occlusion plane, this so-called SPI curve, which should be as flat as possible. Well, to make the decision a little bit more straightforward, to see what is an easy, moderate, or a severe case, I've got some key points for you, and also when to refer to a specialist. So this is quite an overview. What number of crowding, spacing, and so on is quite a moderate case, and when to refer to an expert. Yeah? In crowding and spacing, you see up to, let's say, 4, maximal 5 millimeters of, you can, I think you can treat it yourself in a in a very comfortable and predictable way. 6 millimeters and higher, I would recommend to an expert. Midline deviation up to 2 or 3 millimeters are manageable. 4 and more millimeters you recommend to the expert. Overjet and overbite. So this is a little bit more difficult. Deviation from ideal, what does that mean? An ideal overjet and overbite is considered to be about at 2 millimeters. So the deviation from ideal up to 2 millimeters, which mean an overjet of 4 millimeters, is to be treated by ourselves. And from here on, you recommend the patient to the expert. In the overbite, the numbers are a little smaller. An open bite is the most difficult treatment for us, for aligner treatment. So only really small numbers can be treated with aligners. Well, this is just an overview and recommendation. Next point would be integration and team onboarding. I mean, team onboarding is the most important in our practices. How can we collect our data with minimum effort? How is the clinical procedure? And for that, I've brought you a little film which was made in my practice. I have to lower down the sound. I think it would be too loud. Well, actually, I'm going to watch that movie, that little film, with my new assistants when they start working with me, because they know immediately how it works. So the patient comes and we make a scan. May it be I myself or one of my assistants. We explain everything. I mean, the contacts. We show the quality of the aligners. And in the end, we take some photos, intro and extraorally, and then panoramic view or an CBCT, whatever is necessary. And then, well, the data upload takes place. And after quite a while, I get the staging, already have seen it before the patient comes, and then I explain it to him or her, the whole situation. In case of the agreement, I can order the aligners. I make my file ready to load up. And when the aligners are delivered, we have a little longer appointment. It's about 45 to 60 minutes, because we have to place the attachments. We have to try in the aligners. We have to slice. Well, and we have to give advice to the patient how to use it, use the Deweys, how to wear them, how long, 22 hours per day. And well, if I recall to her after the first 4 aligners, and every 8 aligners, we recommend a hygienic appointments. So this is how it works in my practice. I think you recognized Annika. And how does it work in detail? I make digital pictures, actually not myself. It's all my assistants work. And also the intraoral scan, I give advice to scan 2 more millimeters of gingiva to have very well-fitting aligners in case I choose the straight trim line. I always recommend to scan the upper gum to see the midline while they do X-rays. And this is all we need. The dental exam is more or less my work, or one of my colleagues are doing the exams. This is the place where we have to click on teeth which are missing or which cannot be moved, like implants or special root-treated teeth. We would also here notice if we want to have the midline corrected to the lower or to the upper arch, and so on. So this is the dental exam, which has to be uploaded. And 48 hours, more or less, or let's say 3 days later, we get the so-called staging, which I control of the 6 points and 6 keys of Andrews, and also the points I led through the staging by the SureSmile software. Yeah, so in that moment, I also control the size and the positioning of the attachments, as well as the slicing amount. And if I would have any changings to be made, this would be the moment, and I would get another changing, another setup, another staging quite a few days later. Yeah. The patient appointment, so the setting of the aligners, means also to make the interproximal reduction. And as teeth proclinus, they align, it means that I don't need so much movement, I don't need so much time if I can slice and can make every tooth a little bit smaller, and in the result I get smaller interdental spaces, especially nice for all those teeth which are really triangle formed, so that the interdental spaces are a little bit smaller after the treatment. This is my equipment, what I use for interdental, for IPR. My favorite is the stripes, to be honest. I use some of the space files, but I, more or less do a lot with the stripes, and I can measure the amount of my IPR with the gauge. So those are my instruments. Of course, we have to take care not to make any steps, but have a very smooth interproximal contact. Attachments are fixed with an attachment template, and they have different form. They have not only different forms and different geometry, but also different sizes, and they support the synergy in the movements, especially by rotation and intrusion. And the effect of different attachments, geometries, is also already part of a research, and well, it very much depends on how the attachments are fixed, and also the size of the attachment. So in SureSmile cases, oval, they are rectangular and rectangular beveled. Okay, now coming back to a little more complicated topic in the SureSmile algorithm, and explaining the synergistic and antagonistic combinations maybe is a little hard. I try to explain. Well, single movements like torque or like rotation, I think everyone can imagine how they work. But the combination of synergistic movements, like a positive buckle and a buckle movement and a positive torque, a negative lingual and a negative torque movement, and so on, lead to an increasing speed of the whole treatment, while antagonistic combinations reduce the speed. So you are in every step of your treatment predictable. You know how it works, and you can control the staging. And this algorithm is pretty unique compared to other systems and makes SureSmile aligners so, successful. This is the word. Okay. It's not only in Annika's case, it's in every case. The best comes at last but not least. And there's still one more thing. We are almost done, but there is still one more thing. And this is crucial for our treatment. The retainers. What causes failure of fixed orthodontic retention? Well, not to control. This is the answer. Either you use fixed or loose retainers, please control them the first 6 months after bonding. Yeah, I think this is the most important message. I prefer having fixed retainers in the lower teeth and loose retainers in the upper ones. And SureSmile offers a very affordable system of retainers recently. So I'm a great fan of those retainers who are supposed to also stand clenching and grinding. So I use those for the upper ones and fixed retainers for the lower ones. Well, while in prosthetic, we always strive for biomimetic results. In orthodontics, well, sometimes we need aligners to make it a little bit better than nature did it. And I think starting with aligners helps a lot in not only in bigger treatments, but also in everyday treatment. And using SureSmile aligners helped me a lot, saving material, time, and effort in my treatment, in my daily work. So thank you for listening to me. Hope to see you someday, somewhere in person, and have fun with SureSmile aligners.